The fluorescent lights of Houston City Hospital hummed their eternal song as Emma Carter pushed through the heavy doors of the trauma unit. Her scrubs hung loose on her slender frame, forest green and freshly pressed, though she'd deliberately chosen a size up to avoid drawing attention. Her hair, pulled back in a tight bun, revealed a face that carried stories she'd spent years trying to forget, warm brown eyes that had seen too much, and hands that had once held lives together under mortar fire. She was 34 years old, but some mornings she felt ancient. "New girls here," someone muttered near the nurse's station. Emma didn't look up. She'd learned long ago that invisibility was sometimes the kindest gift you could give yourself. The other nurses barely glanced her way as she clocked in, their conversations flowing around her like water around a stone. She was used to it, the position of the outsider, the one who didn't quite belong. Emma had been many things in her life. A daughter who'd grown up in a small house in Third Ward, where her grandmother raised her on scripture and sweet tea. A student who'd worked double shifts at a diner to pay for nursing school. A combat medic who'd served 2 tours in Iraq, where she'd learned that the line between life and death could be as thin as a heartbeat, as fragile as a prayer whispered in the dark. But that was before the incident she couldn't speak about. Before the guilt that followed her home like a shadow she couldn't shake. Now she was just Emma Carter, RN, the quiet one who took the difficult shifts nobody else wanted, who never complained, who kept her head down and her past buried. The attending physicians barely acknowledged her presence as she made her rounds, checking vitals, adjusting IVs, offering small comforts to patients who were too tired or too medicated to really see her. Dr. Blake Hale was different, though. He saw her, and what he saw, he didn't particularly like. "Nurse Carter," he'd said on her second day, his voice carrying that particular tone of condescension she'd heard too many times before. "I trust you'll remember that this is a civilian hospital. We have protocols here, established procedures. We don't need any improvisation." The pause before that last word had been deliberate, weighted with meaning. Someone had told him about her military background, and he'd clearly already decided what kind of nurse that made her. The reckless kind, the undisciplined kind, the kind who thought rules didn't apply to her. Emma had simply nodded, her voice soft and steady. "Yes, doctor, I understand." She'd learned that lesson too. Sometimes the best response was no response at all. Let them think what they wanted. Let them underestimate her. It was safer that way, for everyone. The other nurses followed Dr. Hale's lead. When Emma suggested a different positioning for a patient in respiratory distress, her idea was dismissed with barely concealed eye rolls. When she quietly mentioned that a patient's symptoms might indicate a complication the doctors had missed, she was told, politely but firmly, to stay in her lane. So she did. She stayed quiet, stayed small, stayed out of the way. But late at night, when the unit grew still and she walked the halls alone, Emma sometimes let herself remember. Remember the sand and the heat. Remember the faces of the soldiers she'd saved. Remember the weight of responsibility, the sharp clarity of purpose, the feeling of knowing, truly knowing, that her hands, her knowledge, her instincts mattered. She missed that version of herself. The one who'd been certain. The one who'd been brave. That version had died in Iraq, in a moment of hesitation that cost a life she should have saved. Or so she'd told herself every day since coming home. Tonight, the August humidity pressed against the hospital windows like a living thing. The trauma unit was busier than usual. A multi-vehicle accident on I-45 had filled most of the beds. Emma moved through the chaos with practiced efficiency, a ghost in green scrubs, helping where she could, invisible where she couldn't. She didn't know that everything was about to change. She didn't know that in less than an hour, a military transport would arrive carrying a Navy Special Forces captain with a dying arm and a memory that reached back across years and continents. She didn't know that the past she'd been running from was about to catch up with her, whether she was ready or not. For now, she was just Emma. Simple, quiet, humble Emma Carter. And that, she'd convinced herself, was all she'd ever be again. The ambulance bay doors burst open at 11:47 p.m., and the controlled chaos of the trauma unit shifted into a higher gear. Emma was restocking supply carts near the nurse's station when she heard the urgency in the paramedic's voice, that particular pitch that meant someone's life was hanging by a thread. Navy Special Forces, severe vascular compromise left upper extremity, the lead paramedic called out as they wheeled the gurney through. Pulse is thready, fingers are white, he's been like this for 3 hours. Injury occurred during a training exercise at Ellington Field. Dr. Hale appeared immediately, his team falling in behind him like well-trained soldiers themselves. Emma watched from her position near the wall, her hands still clutching a box of gauze, as they transferred the patient to bed 7. Even from a distance, she could see the problem. The left arm was wrapped tightly against the chest, the compression bandage dark with old blood, the hand below it an unnatural shade of alabaster. "Get him prepped for emergency surgery," Dr. Hale ordered, his voice clipped and efficient. "We're looking at probable amputation. Someone page the surgical team and let them know we're coming up." The words hit Emma like a physical blow. Amputation. She'd heard it too many times in the field, the word that meant a warrior would never be whole again, never hold a rifle, never feel complete. She'd fought against that word with everything she had, every time. "Nurse Carter, stop standing there like a statue. We need warm blankets and another IV line started now." Dr. Hale's sharp command snapped her back to the present. She moved quickly, professionally, gathering what was needed. As she approached the bedside, her eyes fell on the patient's face for the first time. He was maybe 40 years old, his features carved with the hard edges of a man who'd spent his life in harm's way. Dark hair peppered with gray, a jawline that spoke of discipline and determination, and even through the pain medication, an alertness in his eyes that suggested he was tracking everything happening around him. Those eyes locked onto Emma's face as she leaned in to adjust his blanket, and something flickered in them, recognition, surprise, confusion all at once. "Sergeant Carter." His voice was rough, barely above a whisper, but the name hit her like a freight train. Emma's hands froze. Her heart began to hammer against her ribs. She looked at him more carefully now, searching his face for the memory that was trying to surface. It had been so many years, so many faces, so many soldiers she'd patched up under fire, and then she saw it. The scar along his right temple, the particular set of his eyes. Fallujah. It had been Fallujah 7 years ago during the worst 3 days of her deployment. This man had been a young captain then, leading a team that had walked into an ambush. She'd worked on him for 20 minutes in the back of a Humvee while bullets pinged off the armor, her hands slick with his blood, her voice steady as she talked him through it, keeping him conscious, keeping him alive. Captain Cole Hunter. That was his name. She remembered now. "Captain," she said softly, automatically, the military courtesy rising up from somewhere deep inside her. Then she caught herself, glancing around nervously. No one else had heard their exchange. They were all too busy with assessments and preparations. "I knew it was you," Cole said, and despite his pain, despite the morphine clouding his thoughts, there was certainty in his voice. "Thought I was hallucinating at first, but it's really you. You saved my life in Fallujah. Never forgot your face. Never forgot what you did." "Captain, you need to rest," Emma said quietly, tucking the blanket around him with gentle efficiency. Her professional mask was firmly in place, but inside she was reeling. "Let the doctors take care of you." "Your arm is done, Captain," Dr. Hale said, returning to the bedside with X-rays in hand. He hadn't noticed the exchange between Emma and his patient. "The vascular damage is extensive. We're looking at a high probability that the limb isn't salvageable. I'm sorry, but we need to move fast if we're going to save your life. The tissue death could lead to systemic infection. Wait." Cole's voice was stronger now, cutting through the doctor's clinical assessment. "Let her look at it first." Dr. Hale blinked, confused. "Excuse me, Nurse Carter. Let her examine it before you make any decisions." A ripple of surprise moved through the staff around the bed. Dr. Hale's expression shifted from confusion to barely concealed irritation. "Captain, I appreciate your service, but Nurse Carter is not a surgeon. She's not even part of the surgical assessment team. What you need is—" "What I need," Cole interrupted, his eyes never leaving Emma's face, "is someone who's kept soldiers whole under worse conditions than this. Someone who knows combat trauma. Sir, with all respect, I've seen her work miracles with less than what you've got here." The silence that followed was heavy and uncomfortable. Emma felt every eye in the trauma bay turned toward her. Dr. Hale's face had gone red, a mixture of professional offense and something darker, the irritation of a man whose authority had just been questioned. "This is highly irregular," Dr. Hale said, his voice tight. "5 minutes," Cole said. It wasn't a request. Despite being flat on his back, hooked to monitors and half destroyed by pain, he carried an authority that filled the room. "Give her 5 minutes to assess. If she agrees with you, I'll go to surgery without another word." Dr. Hale looked like he wanted to argue, but something in the captain's tone, or perhaps the awareness that arguing with a decorated Special Forces officer might not play well, made him hesitate. He turned to Emma, his expression making his feelings crystal clear. "Well, Nurse Carter, the captain seems to think you have some expertise the rest of us lack. Would you care to assess the situation?" The sarcasm in his voice was unmistakable. A few of the other nurses exchanged glances, some sympathetic, others amused. This was Emma's chance to stay small, to stay invisible, to defer to the doctors, and let things proceed as they would have anyway. But Cole Hunter was watching her with eyes that remembered. Eyes that had seen her at her best, her bravest, her most competent. Eyes that held a faith she'd lost in herself years ago. Emma took a slow breath, feeling something shift inside her chest, something that had been locked away for too long. "May I see the arm, doctor?" she asked quietly. The words were simple, humble even, but they were the first step toward becoming herself again. Dr. Hale's jaw tightened, but he stepped aside with an exaggerated gesture of permission that made his disdain perfectly clear. "By all means, Nurse Carter. Enlighten us." Emma moved to Captain Hunter's left side, her hands already reaching for the medical gloves on the nearby cart. The other staff members watched with varying degrees of curiosity and skepticism. One of the younger residents, Dr. Patricia Reynolds, looked genuinely interested. The others just looked uncomfortable, as if they were witnessing something inappropriate. As Emma carefully began unwrapping the compression bandage, she felt the weight of 7 years pressing down on her shoulders. 7 years since Fallujah. 7 years since the incident that had broken her confidence and sent her running from the battlefield to the quiet anonymity of civilian nursing. 7 years since she'd lost a young Marine named Marcus Webb because she'd hesitated for 3 seconds, just 3 seconds, trying to decide between 2 equally critical patients. Those 3 seconds had haunted every moment since. The bandage came away in layers, revealing swollen tissue and a hand that looked more like marble than living flesh. Emma's trained eye took in every detail. The pattern of the swelling, the exact coloration of the skin, the positioning of the arm against the body. She'd seen this before, more times than she could count. The room had grown quiet. Even the constant beeping of monitors seemed muted. "What happened, Captain?" Emma asked softly, her fingers moving with careful precision as she palpated the swollen tissue, checking for specific landmarks she'd learned to find in field conditions. Cole grimaced but answered. "Fast rope exercise from a helicopter. Caught the line wrong during descent. Felt something pop in my shoulder. Arm went numb immediately. Medic on site wrapped it tight to stabilize for transport." Emma nodded, her mind already working through the mechanics of the injury. She could feel Dr. Hale's impatience radiating from across the bed, could sense the barely suppressed sighs of the other staff members. They thought this was theater. They thought she was wasting time, playing pretend at being something she wasn't. Maybe they were right. Maybe she was just fooling herself, trying to recapture something that had died in the desert 7 years ago. But her fingers found what they were looking for, the telltale tension of a vascular compartment syndrome complicated by positioning and compression. The artery wasn't severed. It was trapped, kinked by swelling and improper bandaging, strangled by pressure that had built up over hours. This wasn't a surgical problem. This was a field problem. The compression bandage, Emma said quietly, still working. It was applied too high and too tight. Combined with the swelling from the initial injury, you've got the brachial artery caught in a pressure trap. The blood flow didn't stop because the vessel was torn. It stopped because it got pinched off. Dr. Hale scoffed. That's a very confident diagnosis from someone who hasn't even seen the imaging yet. Captain, the X-rays clearly show. The X-rays show bone and tissue displacement, Emma interrupted, her voice still soft but carrying an edge of certainty that surprised even herself. They don't show real-time vascular flow. They don't tell you whether a vessel is severed or compressed. She looked up at Dr. Hale, meeting his eyes directly for the first time since she'd started working at Houston City Hospital. In field conditions, we learned to distinguish between the two. We had to. We didn't have operating rooms or CT scanners 5 minutes away. We had our hands, our training, and our instincts. This isn't a battlefield, Nurse Carter. This is a hospital with proper protocols, and sometimes protocols miss what experience catches, Cole said, his voice cutting through the tension. I've been injured before, doctor. I know what a severed vessel feels like. This is different. Emma was already moving, her hands working with a confidence that seemed to flow from somewhere outside herself. She'd done this before, not in a hospital, but in the back of transport vehicles, in makeshift aid stations, in the dusty courtyards of Iraqi compounds, where the only light came from flashlights held by terrified 19-year-olds. I need a pulse oximeter on his fingers, she said, her voice taking on the calm authority of someone who knew exactly what they were doing. And I need everyone to give me some space. Dr. Patricia Reynolds moved immediately, clipping the monitor onto Captain Hunter's index finger. The reading was almost non-existent, a weak, thready signal that confirmed what Emma already knew. The tissue was dying, but it wasn't dead yet. Nurse Carter, I really must insist that Dr. Hale began. 30 seconds, Emma said, not looking up. Her hands were positioned now, one supporting the captain's shoulder, the other at a specific point on his upper arm. If I'm wrong, you lose 30 seconds. If I'm right, you save a surgical team, hours of operating time, and this man's career. Before Dr. Hale could respond, Emma executed a maneuver she'd learned from a grizzled Army surgeon during her first deployment, a specific combination of pressure release, positioning, and tissue manipulation designed to open compressed vascular pathways. It looked simple, almost gentle, but it required precise knowledge of anatomy and years of experience to know exactly where and how to apply pressure. For a handful of heartbeats, nothing happened. The pulse oximeter continued its weak, irregular beeping. Dr. Hale opened his mouth to speak, probably to order her away from the patient. And then Captain Hunter's fingers twitched. The beeping from the pulse oximeter suddenly steadied, strengthened. Color began to flow back into the pale flesh like paint spreading across a canvas. Pink, then red, then the healthy tan of living tissue. Emma could feel the change beneath her hands, the subtle shift as blood flow returned, as the trapped artery released, as life surged back into dying tissue. "Oh my God," Dr. Reynolds whispered. The monitors confirmed what everyone could now see. Strong, steady pulse, normal oxygen saturation, viable tissue. Emma held the position for another 30 seconds, making sure the flow stayed stable, then slowly, carefully, released her hold. She checked the pulse manually at the wrist, strong and regular. Captain Hunter flexed his fingers experimentally, wonder spreading across his face. "I can feel it. I can actually feel my hand again." The trauma bay had gone completely silent. Every staff member stood frozen, staring at what had just happened. Emma stepped back from the bedside, suddenly aware that her hands were trembling. She tucked them into the pockets of her scrubs before anyone could notice. Dr. Hale looked at the monitors, then at the captain's restored hand, then at Emma. His face had gone through several shades of red and had settled on a mottled purple. He opened his mouth, closed it, opened it again. "That was," Dr. Reynolds began, her voice filled with genuine amazement. "That was extraordinary. I've never seen anything like it." "It's a field technique," Emma said quietly, her eyes downcast. "Something we used in combat situations when amputation wasn't an option. I remembered it from before." Before anyone could respond, Captain Hunter did something that stopped every conversation in the trauma bay. Despite the IV lines, despite the pain, despite the monitors attached to his chest, he lifted his right hand to his forehead in a crisp military salute. "Thank you, Sergeant Carter," he said, his voice formal and filled with respect. "Once again, you've saved more than just my life. You've saved my future." Emma felt tears burning behind her eyes but refused to let them fall. She returned the salute automatically, muscle memory from another lifetime. "Just doing my job, sir," she whispered. But they both knew it was more than that. It was redemption. It was the past and present colliding. It was proof that maybe, just maybe, she hadn't lost everything in the desert after all. The morning after Captain Hunter's treatment, Emma arrived for her shift to find the atmosphere in the trauma unit had shifted. Conversations stopped when she entered rooms. Eyes followed her down hallways. Some looks held curiosity, others held something harder to define, a mixture of respect and resentment that made her stomach clench with familiar anxiety. She'd been here before, in other places, other times. The outsider who'd done something unexpected. The quiet one who'd suddenly become visible. It never ended well. Dr. Blake Hale was waiting at the nurse's station when she clocked in, his expression carved from stone. "Nurse Carter, my office, now." The two words carried the weight of authority and barely contained anger. Emma followed him down the corridor, past the curious stares of her colleagues, into the small administrative office where evaluations were conducted and disciplinary actions were issued. Dr. Reynolds was already there, along with the unit's supervisor, Margaret Chen, a stern woman in her 50s who ran the trauma unit with ironclad efficiency. "Close the door," Dr. Hale said. Emma did, then stood with her hands clasped in front of her, waiting. She'd learned long ago that silence was often the safest response when people in power were angry. "What you did last night," Dr. Hale began, his voice tight with controlled fury, "was completely inappropriate. You overstepped your role as a nurse, you undermined my authority as the attending physician, and you performed an intervention without proper authorization." "She saved a man's arm," Dr. Reynolds interjected quietly. "Maybe even his life." The surgical team confirmed that the vascular pathway had been successfully restored. They said if we'd gone ahead with the amputation, it would have been unnecessary. Dr. Hale's face darkened. "That's not the point, Patricia. The point is protocol. The point is hierarchy. The point is that nurses don't make diagnostic decisions or perform interventions without direct supervision from a physician. If we allow every nurse to start playing doctor whenever they feel inspired—" "I wasn't playing doctor," Emma said softly. "I was using a specific combat medical technique for a field injury. Captain Hunter asked me to assess the situation and I did." "You should have deferred to my judgment," Dr. Hale snapped. "I'm the attending physician. I have 15 years of trauma surgery experience. You're a nurse with, what, some military training. That doesn't give you the right to countermand my medical decisions." Margaret Chen leaned forward, her expression neutral but her eyes sharp. "Dr. Hale has raised concerns about your conduct, Emma. While the outcome was positive, we need to be clear about boundaries and professional roles. This is a teaching hospital with established protocols for a reason." Emma felt the familiar weight settling over her shoulders, the weight of being too much and not enough at the same time. Too knowledgeable for her station, not deferential enough to authority, too confident in her skills, not humble enough in her demeanor. She'd felt this weight before in other hospitals, other units. It was why she'd learned to stay quiet, to stay invisible. The moment you stood out, the moment you showed that you knew more than people expected you to know, the system pushed back. "I understand," Emma said, her voice barely above a whisper. "It won't happen again." "See that it doesn't," Dr. Hale said. "Consider this a formal warning. Any future incidents of overstepping your role will result in suspension or termination." As Emma turned to leave, Dr. Reynolds spoke up again. "For what it's worth, I think what you did was remarkable. I'd like to learn more about those field techniques sometime if you'd be willing to teach." The offer was kind, genuine, but Emma could see the warning in Margaret Chen's eyes, could feel Dr. Hale's anger still radiating across the small office. Teaching others would only make her more visible, more of a target. "Maybe someday," Emma said softly, then left before anyone could say more. The rest of the day passed in a blur of routine tasks and carefully maintained invisibility. Emma kept her head down, spoke only when spoken to, and tried to recapture the safe anonymity she'd cultivated over the past 2 years. But something had changed. The other nurses treated her differently now, some with newfound respect, others with thinly veiled hostility. Sarah Williams, a nurse who'd been with the unit for over a decade, cornered Emma in the supply room during lunch. "You made us all look bad last night," Sarah said, her voice low and sharp. "Showing off like that, making Dr. Hale look incompetent in front of everyone. You think you're special because you were in the military." "I wasn't trying to show off," Emma said quietly, organizing bandages with shaking hands. "I was just trying to help." "Well, your help has consequences. Dr. Hale is one of the most respected surgeons in this hospital. You embarrassed him, and when he's embarrassed, he makes life difficult for everyone in this unit." Sarah wasn't wrong. Over the next few days, Emma noticed Dr. Hale finding fault with everything she did. Her charting was too detailed. Her patient interactions took too long. She was spending too much time on individual cases instead of keeping the workflow moving. Every action was scrutinized, every decision questioned. Other doctors began following his lead, treating her with a cold formality that made it clear she wasn't part of the team. She was a problem to be managed. Meanwhile, Captain Hunter's recovery was progressing remarkably well. The surgical team had kept him for observation, running tests to ensure the vascular restoration remained stable. Every report confirmed what Emma had known in her gut. The intervention had worked perfectly. No tissue death, no complications, full sensation and mobility returning to the hand and arm, but Emma wasn't allowed anywhere near his room. Dr. Hale had personally reassigned her duties to ensure she had no contact with the captain, citing professional boundaries and avoiding conflicts of interest. It was on the 5th day after the incident that things came to a breaking point. Emma was at the nurse's station, updating patient charts, when she overheard a conversation between Dr. Hale and 2 residents. They didn't realize she was sitting just around the corner, out of sight. "The problem with military nurses," Dr. Hale was saying, his voice carrying that professorial tone he used when teaching, "is that they come in here thinking their battlefield experience makes them experts. They don't understand the complexity of civilian medicine, the importance of protocols and proper oversight." "But Dr. Hale," one of the residents said hesitantly, "Nurse Carter's intervention did save Captain Hunter's arm. Doesn't that count for something?" "It counts for luck," Dr. Hale replied. "And luck isn't medicine. What if she'd been wrong? What if she damaged the vessels further, caused an embolism, created complications we'd have to fix? She got lucky and now she thinks she's some kind of hero. But heroes get people killed. Protocols save lives." The words hit Emma like physical blows. Heroes get people killed. She closed her eyes, fighting against the wave of guilt that threatened to drown her. Because he was right, wasn't he? Heroes did get people killed. She knew that better than anyone. She'd been a hero once, had believed in her own abilities, her own judgment. And Marcus Webb had died because of it. Her hands trembled as she set down her stylus. Maybe Dr. Hale was right. Maybe she'd just gotten lucky with Captain Hunter. Maybe she should have stayed in her lane, stayed quiet, stayed invisible where she belonged. That evening, as Emma was gathering her things to leave, Margaret Chen approached her with an envelope. "This is a formal letter of reprimand," Margaret said, her voice not unkind but firm. "It will go in your permanent file. Dr. Hale has also requested that you be transferred to a different unit. The hospital administration is considering his request." Emma took the envelope with numb fingers. "I understand." "Emma," Margaret said, and for the first time her professional mask slipped slightly, "you're a good nurse. But you need to learn to work within the system, not against it. That's how you survive in a place like this." Emma nodded, not trusting her voice. She left the hospital as the sun was setting, the Houston heat still oppressive even in the evening. She walked to her car in the parking garage, the envelope heavy in her bag, the weight of failure heavy on her shoulders. She'd tried to help. She'd done what she thought was right. And now she was being punished for it, just like always. She sat in her car for a long time, staring at nothing, feeling the familiar darkness creeping in. The voice that told her she didn't belong, that she'd never belong, that maybe it would be easier to just give up entirely. But somewhere in the back of her mind, she could still feel Captain Hunter's hand warming beneath her fingers, could still see the gratitude in his eyes, could still remember what it felt like to be confident, capable, certain of her own skills and judgment. Maybe that version of herself wasn't completely dead after all. Maybe she was just buried, waiting. Emma spent the next week moving through her shifts like a ghost, saying little, doing exactly what was asked of her and nothing more. She avoided Dr. Hale when possible, kept her interactions with other staff minimal and professional. The letter of reprimand sat in her locker, unread. She couldn't bear to open it, to see her failure documented in official language. She'd given up. It was easier this way. On Thursday morning, she arrived at the hospital to find an unusual amount of activity near the administrative wing. Clusters of staff members stood in hallways, whispering urgently. Something was happening, but Emma kept her head down and headed toward the trauma unit, determined not to get caught up in whatever drama was unfolding. Margaret Chen intercepted her before she reached the nurse's station. "Emma, you need to come with me, now." The tone was urgent, almost nervous, which was completely unlike Margaret. Emma's stomach dropped. This was it. They were going to fire her or transfer her or worse. She followed Margaret through the corridors, past the curious stairs, to the large conference room typically reserved for major meetings with hospital administration. The door opened to reveal a scene that made Emma's breath catch in her throat. Captain Cole Hunter sat at the head of the conference table, now dressed in his Navy uniform, his left arm mobile and functional at his side. Next to him sat a stern-looking officer in Marine Corps dress blues, a colonel, by the insignia. On the other side of the table sat the hospital's chief of staff, Dr. Gerald Morrison, alongside Dr. Hale, who looked like he'd swallowed something extremely unpleasant. Dr. Patricia Reynolds was there too, along with 3 other staff members from the trauma unit who'd witnessed the incident with Captain Hunter. "Nurse Carter," Dr. Morrison said, gesturing to an empty chair. "Please sit down." Emma's legs felt like water as she moved to the chair. She couldn't read the expressions around the table, some sympathetic, others neutral, Dr. Hale's openly hostile. Captain Hunter met her eyes and gave her a small, encouraging nod. "I'm Colonel Marcus Foster, United States Marine Corps," the officer said, his voice carrying the authority of someone used to being obeyed. "I'm here representing the Department of Defense Medical Command. Captain Hunter contacted my office regarding an incident that occurred here 1 week ago. He's made some serious allegations, and we need to get to the bottom of them." Emma's mind reeled. "Allegations? What kind of allegations?" "Colonel," Dr. Morrison said carefully, "I assure you that this hospital maintains the highest standards of care. If Captain Hunter has concerns about his treatment—" "My treatment was exceptional," Captain Hunter interrupted, his voice firm. "Thanks to one person specifically." He looked directly at Emma. "Sergeant Emma Carter saved my arm when your surgical team was ready to amputate it. She used advanced combat medical techniques that none of your doctors recognized. And instead of being commended for her skill and quick thinking, she's been reprimanded and threatened with termination. The room went very quiet. Dr. Hale leaned forward, his voice tight but controlled. "Captain, with all due respect, Nurse Carter overstepped her authority. There are protocols in this hospital, hierarchies that must be respected. What she did, while well-intentioned, was inappropriate and potentially dangerous." "Potentially dangerous." Captain Hunter's voice rose slightly. "Doctor, I've reviewed my medical records. I've spoken with the surgical team who evaluated me after Nurse Carter's intervention. They confirmed that my brachial artery was compressed, not severed. They confirmed that her technique successfully restored blood flow. They confirmed that if you'd proceeded with amputation as planned, it would have been completely unnecessary." "Outcomes don't justify improper procedures," Dr. Hale argued. "Medicine isn't about cowboy heroics. It's about following established protocols that have been proven safe over decades of—" "Proven safe?" Captain Hunter's eyes flashed. "Your proven safe protocol would have cost me my career, my ability to do my job, my quality of life. Nurse Carter's cowboy heroics saved all of that." Colonel Foster spoke up, his voice cutting through the tension. "Dr. Morrison, I've reviewed Nurse Carter's military service record. She served 2 tours as a combat medic in Iraq. She received commendations for her work under fire. She has extensive experience with exactly the type of injury I sustained. Why was this expertise not utilized or even acknowledged by your staff?" Emma felt dizzy. They were fighting for her. These men she barely knew were fighting for her in a room full of people who had power over her career, her livelihood, her future. Dr. Morrison looked uncomfortable. "Colonel, I assure you that we value the military experience our staff brings. However, this is a civilian hospital with civilian protocols. We have to maintain certain standards, standards that punish excellence." Colonel Foster's voice was sharp now. "Standards that discourage medical personnel from using their full range of training and skills. That seems counterproductive, Doctor." "The issue isn't her skills," Dr. Hale interjected, his voice rising. "The issue is that she acted without authorization. She undermined my medical judgment in front of my entire team. She made me look incompetent." "With respect, Doctor," Captain Hunter said, his voice cold, "you made yourself look incompetent by being ready to amputate a limb that didn't need amputation." The words hung in the air like a grenade. Dr. Hale's face went purple. Margaret Chen looked like she wanted to disappear through the floor. Dr. Reynolds was biting her lip, clearly trying not to smile. "Furthermore," Colonel Foster continued, pulling a folder from his briefcase, "I've been contacted by several other military personnel who have been treated at this facility over the past 2 years. They've shared concerns about the treatment of medical staff with military backgrounds. There seems to be a pattern of dismissing or undervaluing combat medical experience." Dr. Morrison's expression shifted from discomfort to genuine concern. "Colonel, I wasn't aware." "Of course you weren't aware," Colonel Foster said, "because the people affected were junior staff, nurses, technicians, people without the power or authority to push back. People like Sergeant Carter, who have been quietly absorbing disrespect and professional punishment for having skills that make others uncomfortable." Emma felt tears burning behind her eyes. Someone understood. Someone saw what had been happening not just to her but to others like her, the invisible ones, the quiet ones who'd been pushed down and pushed aside. "I want to be clear," Captain Hunter said, his voice formal now, addressing the entire room. "If any disciplinary action is taken against Nurse Carter, I will file a formal complaint with the Department of Defense, the Veterans Health Administration, and every military medical oversight body I can find. I will make sure this case is reviewed at the highest levels, and I will personally ensure that this hospital's reputation with the military medical community reflects how it treats veterans and military medical personnel." The threat was polite but unmistakable. Dr. Morrison looked like He was calculating the political and financial implications of losing military referrals and contracts. Houston City Hospital received significant funding from VA partnerships and military healthcare agreements. A scandal involving mistreatment of a military medical professional could have serious consequences. Dr. Hale opened his mouth to argue, but Dr. Morrison raised a hand to stop him. "Captain Hunter, Colonel Foster, I appreciate you bringing these concerns to my attention. I can assure you that we will conduct a thorough review of this situation and of our policies regarding staff with military medical backgrounds." He turned to Emma, his expression softening slightly. "Nurse Carter, I apologize if you felt undervalued or disrespected. Your military service and expertise should be an asset to this hospital, not a liability." Emma couldn't speak. She just nodded, afraid that if she opened her mouth, she'd start crying. "The letter of reprimand will be removed from Nurse Carter's file," Dr. Morrison continued, shooting a look at Margaret Chen that suggested this wasn't a suggestion, "and we'll be forming a committee to review how we can better integrate combat medical expertise into our trauma protocols." Dr. Hale stood abruptly, his chair scraping against the floor. "If we're done here, I have patients to see." He left without another word, his anger visible in every rigid line of his body. As the meeting broke up, Captain Hunter approached Emma, extending his right hand, the hand that worked perfectly now, thanks to her. "Thank you for saving my arm, Sergeant," he said quietly. "And I'm sorry you had to fight this battle at all. You shouldn't have had to." Emma took his hand, feeling the strong, steady grip, the warmth of living tissue. "You didn't have to do this, Captain. You didn't have to fight for me." "Yes, I did," he said simply, "because you fought for me when I needed it. That's what we do for each other. That's what being part of a team means." After he left, Dr. Reynolds came over, her expression warm. "For what it's worth, you've got an ally in me. What you did was brilliant, and anyone with eyes could see it. Don't let people like Hale make you small. The world needs nurses who are willing to use everything they know." Emma nodded, still unable to fully process what had just happened. For the first time in 7 years, someone had stood up for her. Someone had fought on her behalf. Someone had seen her value and refused to let it be diminished. It felt like coming up for air after years underwater. Maybe, just maybe, she didn't have to stay invisible forever. The days following the confrontation were strange and unsettling. Emma had expected relief, maybe even gratitude from her colleagues, but what she got instead was a complicated mix of responses that left her feeling more isolated than ever. Some staff members were genuinely supportive. Dr. Reynolds went out of her way to include Emma in discussions, to ask her opinion on difficult cases, to treat her like a valued colleague rather than a subordinate. A few of the younger nurses looked at her with something like admiration, occasionally stopping by with questions about combat medicine or asking her advice on complicated trauma cases. But others, especially those in Dr. Hale's inner circle, made their displeasure clear in subtle ways. Assignments that should have gone to Emma were given to others. She was left out of important briefings. When she entered the break room, conversations would halt mid-sentence, resuming only after she'd left. Dr. Hale himself had become ice personified. He addressed her only when absolutely necessary, his voice clipped and formal, his eyes cold. He never openly broke protocol or did anything that could be reported, but his disdain was palpable, hanging in the air like smoke whenever they were in the same room. "You've made an enemy," Sarah Williams told Emma one evening, her tone almost pitying. "Dr. Hale doesn't forgive people who embarrass him. He'll wait, he'll watch, and when you make a mistake, and everyone makes mistakes eventually, he'll use it to destroy you." The words haunted Emma through sleepless nights. She'd won the battle, but maybe not the war. The letter of reprimand had been removed from her file, but the damage to her reputation within the unit remained. She was marked now, the troublemaker, the one who'd gone over everyone's heads, the one who'd brought military officers and hospital administration crashing down on their little world. 2 weeks after the meeting, Emma was working a night shift when a multi-vehicle accident brought chaos to the trauma unit. Ambulances arrived in waves, bringing broken bodies and desperate cases that pushed the staff to their limits. Emma moved through the controlled chaos with practiced efficiency, triaging patients, starting IVs, assisting with emergency procedures. It was past midnight when a young man, maybe 22 years old, was brought in with severe chest trauma. Emma recognized the signs immediately: tension pneumothorax, air building up in the chest cavity and compressing the lungs. He needed immediate decompression or he'd die within minutes. "I need Dr. Hale or Dr. Reynolds now," Emma called out, her hands already preparing the necessary equipment. "Dr. Reynolds is in surgery, and Dr. Hale is with a critical patient in Bay 3, another nurse responded. "You're on your own for at least 5 minutes." 5 minutes was too long. The young man's lips were already turning blue, his breathing shallow and rapid, his oxygen saturation plummeting. Emma had done this procedure dozens of times in the field: needle decompression, a quick intervention that could save a life in seconds. But this wasn't the field. This was a civilian hospital with protocols and hierarchies. She could wait for a doctor and watch this man die, or she could act on her training and risk everything she just fought to protect. The choice took less than a second. Emma positioned the needle carefully, found the landmark between the ribs, and performed the decompression. There was a distinctive rush of air as the trapped pressure released. The young man gasped, his color immediately improving, his oxygen saturation climbing back toward normal levels. By the time Dr. Hale arrived 3 minutes later, the patient was stable, breathing more easily, his vital signs returning to acceptable ranges. Dr. Hale took one look at the situation, at the needle in the patient's chest, at Emma's calm expression, and his jaw clenched so tight she could see the muscles jumping. "What did you do?" His voice was dangerously quiet. "Tension pneumothorax," Emma said steadily. "He was crashing. I performed needle decompression to stabilize him until a physician could insert a chest tube. Without authorization." "Again." "Sir, he would have died waiting for authorization. His oxygen saturation was dropping below 70%. I made a clinical judgment call based on immediate life threat." The other nurses in the bay had gone quiet, watching the confrontation unfold. The patient, now stable on oxygen, looked between them with confused, grateful eyes. "You made a judgment call," Dr. Hale repeated, his voice dripping with sarcasm. "How convenient, how heroic. Tell me, Nurse Carter, do you plan to make judgment calls every time you disagree with hospital protocol? Every time you think you know better than the physicians supervising you?" "I don't think I know better," Emma said quietly. "But I do know that man would be dead right now if I'd waited, and I couldn't let that happen." "You couldn't," Dr. Hale said, stepping closer. "Or you wouldn't. There's a difference. One is about necessity, the other is about ego, about needing to be the hero, to prove how special you are, how much better your military experience makes you." The words were designed to wound, and they hit their mark. Emma felt her composure cracking, felt the old guilt rising up like bile. "This isn't about ego," she said, but her voice was less steady now. "This is about saving lives." "No," Dr. Hale said, his voice cold and final. "This is about a nurse who refuses to stay in her lane, who thinks she's above the rules that govern the rest of us, who puts her own judgment above the established medical hierarchy." He turned to the nurse supervisor who'd just arrived. "I want a formal incident report filed. Nurse Carter performed an invasive procedure without physician authorization. This is her second violation of hospital protocol in less than a month." Emma's heart sank. She'd known this was coming, had known from the moment she'd picked up that needle. But knowing didn't make it hurt less. The rest of the shift passed in a blur. Emma completed her duties mechanically, avoiding eye contact, speaking only when necessary. When she finally clocked out at dawn, she found Margaret Chen waiting for her in the administrative hallway. "Emma," Margaret said, her voice heavy with reluctance, "I need you to take a few days off while we investigate this incident. Paid leave, not a suspension, but..." Dr. Hale has filed a formal complaint. The hospital has to take it seriously. I understand, Emma said, too tired to fight anymore. The patient is fine, by the way, Margaret added softly. The thoracic surgeon who placed the chest tube said your intervention probably saved his life. Said you did everything exactly right. But that doesn't change the fact that you violated protocol. Emma nodded numbly. She'd saved a life and was being punished for it. Again. The pattern was becoming depressingly familiar. She drove home in the gray morning light, her hands steady on the wheel but her heart heavy in her chest. She tried to stand tall, tried to be herself, tried to use her skills to help people. And the system was crushing her for it. Maybe Dr. Hale was right. Maybe she was too proud, too confident, too unwilling to accept her place in the hierarchy. Maybe heroes did get people killed. And maybe trying to be a hero got you destroyed too. She thought about Marcus Webb, the young Marine she'd failed to save in Fallujah. She'd been trying to be a hero that day too, trying to save everyone, and her hesitation had cost him his life. Maybe that had been the universe's way of telling her to stay small, to stop trying to be more than she was. Emma spent the next 3 days in her small apartment, staring at walls and questioning everything. The investigation was ongoing. Her future at Houston City Hospital hung in the balance, and she had no idea what came next. But on the 3rd day, her phone rang. Unknown number. Hello, Sergeant Carter. This is Colonel Foster. I heard about what happened at the hospital. Captain Hunter and I have been discussing the situation, and we think it's time to call in some reinforcements. Are you willing to fight, or have they beaten you down? Emma closed her eyes, feeling tears slip down her cheeks. I don't know anymore, sir. I'm tired of fighting. I understand, Colonel Foster said, his voice gentler now. But sometimes the fights we don't want to have are the ones that matter most. Not just for us, but for everyone who comes after us. Think about it. We're here if you need us. He hung up, leaving Emma alone with her thoughts and a question she'd been avoiding for 7 years. Who was she willing to be? The invisible one who stayed safe and small, or the woman who stood tall no matter the cost? The answer, she was beginning to realize, might determine everything. Emma returned to Houston City Hospital on Monday morning with her shoulders back and her head high. She'd spent the weekend thinking, praying, and finally accepting a truth she'd been running from since Fallujah. She couldn't save everyone, but that didn't mean she should stop trying to save anyone. Marcus Webb's death had broken something inside her. She'd carried that guilt like a stone in her chest, letting it weigh her down, convince her that she didn't deserve to be confident, didn't deserve to use her full abilities. But Marcus wouldn't have wanted that. None of the soldiers she'd saved would have wanted that. It was time to stop punishing herself. The hospital administration had called a formal hearing to review both incidents, Captain Hunter's case and the pneumothorax patient. Emma had been told to prepare a statement, and that she could bring a representative if she wished. She'd initially planned to go alone, to face whatever came with quiet dignity. But when she walked into the conference room, she found she wasn't alone after all. Captain Hunter was there in his dress uniform, his arm moving smoothly and naturally at his side, living proof of her skill. Colonel Foster sat beside him, his Marine Corps blues carrying unmistakable authority. Dr. Patricia Reynolds was present, along with 3 other nurses from the trauma unit who'd witnessed Emma's interventions. And there, in a corner seat, was a face Emma hadn't seen in 7 years. Major Lisa Washington, the Army surgeon who'd trained her in combat medicine in Iraq, who taught her the techniques that had saved Captain Hunter's arm. Emma's eyes filled with tears. Major Washington, what are you doing here? Supporting one of the finest combat medics I ever trained, Major Washington said with a warm smile. Colonel Foster tracked me down, said you needed backup. I flew in from Fort Sam Houston this morning. On the other side of the table sat Dr. Hale, looking confident and prepared, alongside the hospital's legal counsel and Dr. Morrison. Margaret Chen sat between the two groups, her expression neutral but her eyes sympathetic. Dr. Morrison opened the hearing. We're here to review two incidents involving Nurse Emma Carter and determine whether her actions violated hospital protocol in ways that warrant disciplinary action or termination. Dr. Hale has filed formal complaints regarding both cases. Nurse Carter, you'll have a chance to respond to these allegations. Dr. Hale presented his case with clinical precision. He outlined hospital protocols, explained the chain of command, emphasized the importance of physicians making final decisions on invasive procedures. He painted Emma as a rogue actor, someone who repeatedly ignored authority and put patients at risk with unauthorized interventions. The issue isn't whether the outcomes were positive, Dr. Hale concluded. The issue is that Nurse Carter consistently acts as though rules don't apply to her. She undermines the medical hierarchy, confuses patients about who's actually in charge of their care, and creates liability risks for this hospital. Her military background doesn't give her license to play doctor. When he finished, Dr. Morrison turned to Emma. "Nurse Carter, what's your response?" Emma stood, her voice steady despite the butterflies in her stomach. "Dr. Hale is right that I violated protocol. Both times, I made decisions that technically weren't within my scope of practice as a civilian nurse. I don't deny that." She saw a flicker of satisfaction cross Dr. Hale's face, but she wasn't finished. "However, I want to be clear about why I made those decisions. In Captain Hunter's case, I recognized a specific injury pattern from my combat experience, a vascular compression that was being misdiagnosed as arterial severance. I knew, with certainty, that amputation would be unnecessary if the compression could be released. I had the training and experience to perform that intervention safely, and Captain Hunter explicitly requested that I assess the situation before proceeding to surgery." She turned to look at Dr. Hale directly. As for the pneumothorax case, that young man was dying. His oxygen saturation was below 70% and dropping. I called for physician assistance, but none was available within the critical time window. I had two choices: perform a life-saving procedure I'd done successfully dozens of times in combat conditions, or watch him die waiting for authorization. I chose to save his life. "At the expense of protocol," Dr. Hale interjected. "Yes," Emma said simply, "at the expense of protocol, because protocols are designed to save lives, not end them. When protocol and patient survival conflict, I will choose the patient every single time." "Then you're admitting you're unreliable," Dr. Hale said, "that you'll violate rules whenever you personally decide they don't apply." "No, sir," Emma said, her voice gaining strength. "I'm saying that good medicine requires both following protocols and knowing when a situation demands exception. Combat medicine taught me to assess rapidly, act decisively, and take responsibility for my decisions. Those aren't flaws. They're skills." Major Washington stood then, her voice carrying the authority of years of military medical command. "If I may address the panel, I trained Sergeant Carter in Iraq. I watched her save more lives under impossible conditions than most surgeons will save in their entire careers. The techniques she used with Captain Hunter are advanced field medicine procedures that I personally taught her. They're not reckless. They're highly specialized interventions designed for exactly the situation she applied them to." Colonel Foster added, "The Department of Defense has invested millions of dollars training combat medics like Sergeant Carter. They're trained to function independently, to make critical decisions without physician oversight, because in combat zones, physician oversight isn't always available. To suggest that this training makes them unqualified or dangerous in civilian settings is both inaccurate and insulting." Captain Hunter spoke next. "I'd like to read something into the record, if I may." He pulled out a letter. "This is from the thoracic surgeon who treated the pneumothorax patient after Nurse Carter's intervention. He states, and I quote, 'The needle decompression was performed with textbook precision. Based on the patient's presentation and vital signs, this intervention was absolutely indicated and likely saved the patient's life. Any delay would have resulted in cardiac arrest." He set the letter down. That's not reckless behavior. That's exemplary emergency medicine. Dr. Hale's confident expression had started to crack. This is all very dramatic, but it doesn't change the fundamental issue. This is a civilian hospital with civilian protocols. Nurse Carter may have excellent combat training, but that doesn't give her the authority to— Dr. Hale, Dr. Reynolds interrupted, her voice firm. With respect, I've been watching this situation unfold for weeks now, and I need to say something. The issue here isn't really about protocol violations. It's about ego. Nurse Carter made you look bad and you can't forgive her for it. The room went silent. Dr. Hale's face darkened. Dr. Reynolds, I don't think. I've worked with you for 5 years, Dr. Reynolds continued. You're a brilliant surgeon, and I respect your skills immensely. But you're also someone who doesn't handle challenges to your authority well. Nurse Carter's interventions were medically sound and potentially life-saving, but they made you look like you'd missed something important. And instead of acknowledging her expertise, you've been trying to destroy her career. That's a serious accusation, Dr. Hale said coldly. It's also true, one of the other nurses spoke up. We've all seen it. The way you've treated her since the Captain Hunter incident. The constant scrutiny, the exclusion from cases, the hostile work environment. You've been looking for an excuse to get rid of her. Dr. Morrison raised his hand, calling for order. Let's keep this professional, please. He turned to Emma. Nurse Carter, moving forward, if you were to continue working here, how would you handle similar situations? Emma took a breath. I would continue to call for physician assistance first, always. But if a patient's life is in immediate danger and no physician is available, I would use my training to stabilize them. I can't promise to watch someone die for the sake of protocol. I won't promise that. Then perhaps this isn't the right environment for you, Dr. Hale said. Or perhaps, Dr. Morrison said slowly, it's time we rethought our protocols to better utilize the expertise of our military-trained staff. He looked around the table. Nurse Carter has raised an important question. What do we do when protocol and patient care conflict? In an ideal world, they never would. But we don't live in an ideal world. We live in a world where trauma cases don't always wait for perfect conditions and proper chains of command. He turned to Major Washington. Major, in military medical facilities, how do you handle this kind of situation? We train medics and nurses to function at the highest level of their competence, Major Washington said. We give them protocols as guidelines, but we also give them authority to deviate when the situation demands it. We trust their training and judgment, and we support them when they make difficult decisions under pressure. Dr. Morrison nodded slowly. Dr. Hale, I understand your concerns about maintaining proper medical hierarchy. But I'm also looking at 2 cases where Nurse Carter's intervention saved limbs and lives. I'm looking at a complaint from the Department of Defense about how we treat military medical personnel. And I'm seeing an opportunity to improve our trauma protocols rather than punish someone for excellent emergency medicine. He stood, his decision clearly made. The formal complaints against Nurse Carter are dismissed. There will be no disciplinary action. Instead, I'm authorizing the formation of a special task force to develop enhanced protocols for integrating advanced combat medical techniques into our trauma care. Nurse Carter will serve on that task force, along with Dr. Reynolds and representatives from our surgical department. Dr. Hale looked like he'd been slapped. Dr. Morrison, I must protest. Your protest is noted, Dr. Morrison said firmly. But my decision stands. This hearing is concluded. As the room emptied, Emma stood in stunned silence. She'd won. Not just survived, but actually won. Captain Hunter approached, offering his hand once more. Welcome back, Sergeant, he said with a smile. The real you. Emma shook his hand, tears streaming down her face. Thank you for everything. Thank yourself, he said gently. You're the one who found the courage to stand tall. 3 months later, Emma Carter stood in front of a lecture hall filled with trauma nurses, physicians, and emergency medical personnel from across Houston. The room was packed. standing room only, with people eager to learn about combat medical techniques and their applications in civilian emergency care. It was terrifying and wonderful. "Good morning," Emma began, her voice steady despite her nerves. "My name is Emma Carter, and I spent 4 years as a combat medic in Iraq. Today I'm going to share some of the techniques and approaches that helped me save lives in the field, and how those same techniques can be applied in civilian trauma care." The presentation went smoothly, her confidence growing as she demonstrated procedures, answered questions, and shared stories from her deployment. The audience was engaged, taking notes, asking thoughtful questions. Dr. Reynolds sat in the front row, beaming with pride. Even some of the surgeons who'd initially been skeptical of her were now leaning forward, genuinely interested in what she had to teach. Dr. Hale was noticeably absent. He'd been quiet since the hearing, maintaining professional distance, but no longer actively hostile. Emma suspected Dr. Morrison had had a private conversation with him about appropriate workplace behavior. They'd never be friends, but they'd found a way to coexist. After the presentation, as Emma packed up her materials, a young black woman in nursing scrubs approached hesitantly. "Nurse Carter, I'm Michelle Johnson. I just started in the trauma unit last week. I'm a former Army medic, and I wanted to thank you." Her voice was soft, almost reverent. "I've been trying to make myself small, trying not to let anyone know about my military background because I was afraid of being judged. But watching you stand up for yourself, watching you own your expertise, it made me realize I don't have to hide who I am." Emma felt her throat tighten with emotion. "You never have to hide," she said gently. "Your training, your experience, your skills, they're gifts. The world needs nurses who are willing to use everything they know to help people." Michelle smiled, her eyes bright. "That's what I'm going to do, because of you." As Michelle walked away, Emma felt something shift inside her chest, a lightness she hadn't felt in years. This was why it had all mattered, not just for herself but for all the others like her. The quiet ones, the uncertain ones, the ones who'd been made to feel like their expertise was a liability rather than an asset. Later that evening, Emma sat in her small apartment, a cup of tea cooling in her hands, and allowed herself to reflect on the journey that had brought her here. From the battlefields of Iraq to the trauma unit of Houston City Hospital. From crushing guilt to hard-won redemption. From invisibility to standing in her full truth. Her phone buzzed with a text from Major Washington. "Proud of you, Sergeant. You've come full circle." Emma smiled, typing back. "Thank you for teaching me that medicine is both science and courage." Another text came through, this time from Captain Hunter. "Arms at 100%. Back on active duty next month. Couldn't have done it without you." She responded, "Stay safe out there, Captain. The world needs good men like you." But it was the email that arrived a few minutes later that truly made Emma's heart swell. It was from the family of the young man she'd saved with the pneumothorax intervention. They'd written to thank her, to tell her that their son was fully recovered, back in college, living his life because she'd had the courage to act when it mattered most. "You didn't just save our son's life," the mother had written. "You gave us our future back. Thank you for being brave enough to do what was right, even when it was hard." Emma read the email 3 times, tears streaming down her face. But these were good tears, healing tears. For 7 years she'd carried the weight of Marcus Webb's death, convinced that she didn't deserve to be confident in her abilities, that her hesitation had proven she wasn't worthy of the title she'd once held. But maybe, just maybe, she'd been wrong about that. Maybe making one tragic mistake didn't erase all the lives she'd saved. Maybe being human, fallible, imperfect, sometimes uncertain, didn't mean she had to stop trying to help people with everything she had. She thought about Marcus now, really thought about him for the first time in years without the crushing guilt. She imagined him as she'd last seen him alive, young, brave, full of hope despite the chaos around them. She imagined what he would say if he could see her now. "Don't waste your life mourning mine, Sergeant," she could almost hear him say in that Texas drawl of his. "You saved 30 guys for everyone you lost." That's got to count for something. It does count, Emma whispered to the empty room. It counts for everything. The next morning, Emma walked into Houston City Hospital with her head high, greeting colleagues by name, smiling at patients, moving through the halls with the quiet confidence of someone who finally knew their own worth. The trauma unit had changed in the months since the hearing, not dramatically, but in small, important ways. Military-trained staff were being consulted more frequently. Protocols had been updated to allow for more flexibility in emergency situations. The culture was slowly shifting toward valuing diverse experience rather than dismissing it. Dr. Reynolds pulled her aside near the nurse's station. I have something to tell you. Dr. Morrison is creating a new position, Director of Combat Medical Integration. It would involve training staff, updating protocols, and serving as a liaison between military medical facilities and civilian hospitals. He wants you to take the position. Emma's breath caught. Me. But I'm just a... Don't you dare say you're just anything, Dr. Reynolds interrupted with a smile. You're a highly trained combat medic with years of experience and the courage to stand up for what's right. You're exactly what this hospital needs, what all hospitals need. Emma thought about it for maybe 3 seconds before nodding. I'll do it. Good, Dr. Reynolds said, because I already told him you'd say yes. They both laughed, and Emma realized with a start that she had a friend here now. Maybe more than one. She wasn't invisible anymore. She wasn't alone. That afternoon, as Emma was reviewing case files in her new office, small but hers, she received an unexpected visitor. A young Marine sergeant in dress blues stood in her doorway, looking nervous. Nurse Carter, I'm Sergeant David Chen. I was wounded in Afghanistan 2 years ago. I was told you might be able to help me with something. Of course, Emma said, gesturing for him to sit. What can I do for you? I'm having trouble adjusting to civilian life, he said quietly. I was a combat medic too, and I've been trying to get work in hospitals, but nobody takes me seriously. They see my military background and assume I don't have real medical training. I heard about what happened with you and Captain Hunter, and I wondered, could you give me some advice? Some hope? Emma looked at this young man, this version of herself from years ago, and felt her heart swell with purpose. This was why it had all mattered. Not just to save her own career, but to open doors for others. To create space for people like them to use their gifts without shame or hesitation. I can do more than give you advice, Emma said. I can give you a job. We're hiring for the new Combat Medical Integration Program. If you're interested, I'd like you to be part of the team. Sergeant Chen's face lit up with a hope that Emma recognized intimately. The hope of someone who'd been lost and finally found their way home. Yes, ma'am, he said, his voice thick with emotion. I'd be honored. As evening fell over Houston, Emma stood by the window of her office, looking out at the city lights. Somewhere out there, soldiers were fighting battles she'd never see. Somewhere out there, medics were making impossible decisions under fire. Somewhere out there, people were struggling to find their place in a world that didn't always understand or value them. But here, in this hospital in this city, Emma Carter had found her place. Not by staying small or hiding her light, but by standing tall and letting her expertise shine. She'd learned that redemption wasn't about being perfect. It was about having the courage to keep trying, keep helping, keep showing up as your full, authentic self. She thought of Captain Hunter's strong, functional arm, of the young man with the pneumothorax who was alive and thriving, of Michelle Johnson, who would never have to hide who she was, of Sergeant Chen, who had a future now instead of just a past. And she thought of Marcus Webb, whose death had taught her the hardest lesson, that you can't save everyone, but that doesn't mean you should stop trying to save anyone. Rest easy, Marcus, Emma whispered to the night. I'm finally home, and I'm going to make sure every life I save from here on out honors your memory. The journey from Fallujah to Houston had been long and painful, marked by guilt and grief and hard-won growth. But standing here now, confident, valued, purposeful, Emma Carter knew one thing with absolute certainty. She was exactly where she was meant to be, doing exactly what she was meant to do, and she would never make herself small again. If you enjoyed this story, don't forget to hit the subscribe button and become a part of our Unbroken Grace Stories community. Where are you watching from? Drop a comment below. We love hearing from our amazing viewers all around the world.